We all know the rules by now. Stay home as much as possible to slow the spread of coronavirus. But for survivors of domestic violence and sexual assault and those in potentially dangerous living situations, home is not the same safe space it is for many others. Which is why, as Lieutenant Governor Karyn Polito said last week, there are places people can still turn to.
And in this time of physical distancing, it is critical that we maintain social connection, especially for people who have experienced sexual and domestic violence, who are at greater risk when they are isolated from support. Know that you are not alone and that there are resources available to help you.
Polito says judges are still available 24 hours a day to process restraining orders, and many advocates are still reachable online or over the phone. Now joined by Toni Troop. She's Director of Communications and Development at Jane Doe Inc. Toni, it's good to see you. Thanks for being here. So let me read you some stats that CNN pulled together. Domestic assault and batteries in Boston jumped 22% from March of last year to March of this year. But at the same time, in New York City, domestic violence complaints declined 15%. Can you explain the disparity to me?
You know, we are seeing a real variance across not only Massachusetts, but across the country. And a lot of that has to do with who historically is reaching out to law enforcement, who reaches out for programs, who is even more isolated and more at risk given the pandemic. So all of these factors have always had an impact on the data. You know, there's never one, we've talked about this, there's not one data point. More than 50% of people who experience domestic violence don't actually contact law enforcement. And a lot of people who experience sexual assault don't contact a rape crisis center. So we're always having to look at the big picture and take in lots of different points of, data to determine what's happening. What we know is that people are at greater risk. They are suffering at home. The isolation is compounding that. And we really want to let people know that programs are there to support them. You know,
I've learned from you and others how horrible the risk is in normal times. But when you think about being confined in a space with an abuser or potential abuser, financial stress, health concerns, the whole spectrum of things, it's like the perfect storm, it seems to me, for somebody who wants to abuse another human being, no?
Oh, absolutely. You know, isolation is not only a tactic that people who cause harm use, but it is, in fact, a major risk factor. So we are very concerned that people aren't able to access their healthcare provider. We've heard that some rape victims are not going to the hospital. They're foregoing medical care because they heard the message that they shouldn't go to the hospital unless, they're experiencing COVID symptoms. That is so frightening to us and absolutely a message we need to get out that people should reach out for help and support now.
Can we go back to the person confined, basically imprisoned in their house? Yeah, I listened to Karyn Polito the other day and I thought what she said was important and she said it clearly. What is that? I was going to say woman, but it's more likely to be a woman. What is she supposed to do? How is she supposed to make a phone call? How is she supposed to go online when the abuser is probably practically on top of her full time? What does she do?
Absolutely. We know, and this might sound Pollyannish, but it's true, Jim, that survivors are the most resilient and creative people we know. We have had survivors who've lived in isolation because of a physical, disability, or just that the person abusing them was so controlling. And people find very creative ways. Advocates are looking for creative ways to make connection with people. There are chat lines. 211 is available. There are other systems. It's one of those things. It's like we don't necessarily want to put out, all the tricks here for, people who are causing harm to know what to look out for. But what we can say is that we really want people not only to use their own creativity to think about those opportunities they may have to connect, but really what we also want to do is shift that responsibility off of the victim. So often that's where we put it, right? What we need to be looking at is what can friends, family members, coworkers, and others do. If you're having a sing-along outside and you notice that everybody's coming out except for the people in that one house, maybe you want to go check out on them and say, hey, we're all out here. Let's have a 5 o'clock check-in to make sure everybody's okay today. Find ways of communicating. Come up with your own, language. If you have a friend, if you have a coworker who you know is experiencing it, possibly through your EAP, the Employee Assistance Program, or Human Resources. We need people to think creatively, because you're right, that isolation just compounds a really dangerous situation. And the rest of us are probably better suited to try to break through.
Did you read the piece that some doctor, I think it's from Sloan Kettering, but some hospital in New York City wrote, it was in the Globe the other day, suggesting that we should shut down liquor stores because individuals who are drinking, that makes that perfect storm even more perfect and makes it more likely that they become abusers. Was he on to something or no?
We don't think so on many levels. Domestic violence, sexual violence is not caused by alcoholism, by other forms of substance abuse. It's not caused by losing a job or, having financial stress. If somebody is already causing harm, those other things like alcohol might contribute to the situation and make it more dangerous. But if you're in a perfectly healthy relationship with somebody and you have a perfectly healthy relationship with alcohol, if you drink, then this is not going to change that situation, right? What we need to think about is that in a longer term, both short term and long term, that, those are quick, they seem like quick, easy solutions, but they don't actually solve the problem.
I know you don't want to get into all the, for lack of better, tricks of the trade, access points, all that sort of stuff, even though I do want you to tell me what the Safe Link hotline is in a second that Karyn Polito talked about before. But before we get to that, the most important thing I think you could do that she attempted to do too is to assure either survivors or people who may be threatened that all these resources, all the resources that were there before, whether it's a court, even though the courts are theoretically closed, whether it's a hotline, they are there, correct?
Absolutely. It was so impressive how quickly sexual assault and domestic violence programs around the Commonwealth transition to being remote. We as the coalition represent 57 of the sexual assault and domestic violence programs around the Commonwealth. And every one of them turned their programs into remote services so people can access them through hotlines, which are right now kind of staying steady. But the chat lines, there were only 3 of them before this started. There are now, I think we're up to maybe 8 or 9 local programs that have chat lines available. People are using that technology. And so whether they're calling through a chat line or through their faith leader or their coworkers, or maybe when they go out to a pharmacy or to a grocery store, those places, or a liquor store, where there's places that are still open, that people might have a chance to interact and say, I need help. I need to talk to someone.
I just have a couple of seconds. What is that toll-free safe? I don't need the number. I'll put it on the screen. What exactly is the toll-free Safe Link hotline?
Safe Link has been the domestic violence hotline in Massachusetts for over 20 years. Okay. And it's currently also agreeing to help triage calls for sexual violence. We urge people to go to Jane Doe .org/find help, where they can find their local sexual assault or domestic violence program. We also have national and other resources available for people who are LGBTQ, immigrants, and other marginalized communities. So I really appreciate you taking the time to talk to us about this today. Whether you're a child who's experiencing sexual violence at home, an adult who's in a domestic violence situation, whatever harm you might be experiencing, please, we do want people to know that we're here for you. Please reach out. You're not alone.
Toni, I'm so glad you added the thing about kids, too, who obviously don't have their usual school sports. Toni Troop, as always, thanks so much for your time. I appreciate it.
Thank you. Jim, take good care.
To reach the toll-free Safe Link hotline, call the number on your screen, 877-785-2020. And again, for a full list of national and local domestic violence and sexual assault resources, head to janedoe.org/find help.